Good afternoon, everyone. First of all, it's an honor to be here. And in the spirit of the center, we stand on the shoulders of people who went before us. We stand on the shoulders of our ancestors. We stand on the shoulders of indigenous populations. And we stand on the shoulders of people who fought for this land, who fought for the rights for us to be here, especially during times like now. It's really important for us to honor that we stand on the shoulders. So when I was invited to do this talk, first and foremost, I did not want to talk to you all for 45 minutes, nor did I think you want to hear me for 45 minutes. And when I thought about the concept of images of trust, I believe that you needed to see images. And then so I thought about this concept of how about we actually bring images of Miles Square, where we've been, Miles Square, where we are, and Miles Square, where we're going, and actually display images of trust as we think about that word. Secondly, when I think about this concept of trust, I actually prefer the word trustworthiness. What I mean by that is that I never ask anyone to trust me. I say, let me demonstrate myself to be trustworthy. Because the demonstration of trustworthiness allows trust to be built and trust to happen. As my father used to teach me, it takes years and years and sometimes decades to build trust, but unfortunately it can be destroyed in moments or seconds. And so it was important for us to talk about this image of trust, really grounding ourselves in our history. I'm a deep fan and a studier of history. I believe in understanding, in order to better understand where we're going, you truly have to understand where we've been. I know that's a cliche that we say often, but it's true. And it holds true for Miles Square Health Center. And as I think about the images of trust, community care, cultural humility, and flourishing, those could be the mission statements of Miles Square Health Center. Earlier today, I had the privilege of speaking with, how do I fast forward? Can you? How do I move forward?
I got you.
Okay. Earlier today, I had the privilege of speaking to a partner at NYU in Lagone Medical School, where I was reminded that Miles Square UI Health is one of the only and few federally qualified health centers that has an academic community partner associated with it. So today, as we talk about these images of trust, and before I introduce our panel, I actually,
A little closer.
oh, you need me closer?
A little bit.
Oh, okay. I'm not used to having to use a mic. This is new for me. And so I want to make sure we highlight Miles Square's history and evolution through some key milestones, demonstrate how trust is built through collaboration and team-based care, integrate voices from the past, present, and future to show continuity of our purpose, ground the discussion in health equity and reclaiming our story's mission, and also inspire engagement for the upcoming academic year and future initiatives. And I want to honor the Dean of our Library of Sciences as she comes in, and actually we can give her a round of applause to, no, Ballard, for thanking you for opening your home to this community. That's an example of the principles that we have here. So thank you for that. Next slide. I can take the power. I can change it. Yes. I'm used to being in. There you go. Thank you. Foundations of Healthcare Center. So this photo is so amazing. This is actually the 5 decades of forefront of the community health center movement. These are some of the inaugural community health workers from Miles Square. And if I want to actually read their names to you, because I'm a huge proponent that we have to say their names. So the first 7 community health workers to be hired by Miles Square Health Center were hired by Presbyterian St. Luke Hospital. They received their certificates of graduation from an 8-week course held by the hospital section of community medicine on February 15th in 1967. And from left to right, they're Mary McDaniel, Wadey Moorhead, Geraldine James, Gwendolyn Bolden, Ozell Robinson, Florine Jones, and Fannie Witherspoon. We speak their names and we stand on their shoulders. Because without these community health workers doing the work that they did, holding us true to our mission, I literally would not be here today. And I have to take a pause before we go to this next slide to show you my first introduction to Miles Square was actually as an uninsured community resident of the Chicagoland area. I had just moved here from Michigan as a graduate student. This predated the Affordable Care Act. So when you were a graduate student at that time, you got put off your parents' insurance because you aged out. My parents could not afford, at the time my dad was recovering from colon cancer and complications from diabetes, they could not afford supplemental insurance for me to get care. But we had this history of GI issues in our family. My dad was diagnosed with colon cancer. My brother had been diagnosed with chronic kidney disease, had just got a kidney transplant. And so I was nervous. I was a graduate student, but more importantly, I was an uninsured community member. Someone said, there's a clinic that can see you despite your ability to pay, but you need to bring a bill. True story, you all. I was embarrassed to bring the bill to go through the sliding fee scale because I had to demonstrate some income, because that bill had a thing on it, a big red mark. Some of y'all may not know about this, but it said past due. And I was embarrassed to come and bring that bill to a place that said past due on it, because it didn't feel like a part of my humanity was in question. Was I going to be judged about why the bill was past due? And then when I was told about the sliding fee scale and that I wouldn't have to pay more than, I think at the time it was about $10 or $20, I didn't have that. As a graduate student, I did not have that extra. And so my first introduction to Miles Square was actually as an uninsured patient. And when I was told I could get care there, despite my ability to pay, I wouldn't be judged for that red mark that said past due. Who would have thought that almost 20 years later, I'll be able to come back and be the CEO of that community health center? So being exposed to it first through my lived experience as someone who was uninsured, someone who was afraid, who had a health history that was rooted in health disparities and health inequity. I had lost my birth mother from complications of breast cancer when I was 6 years old. Fast forward in high school, my dad was diagnosed with diabetes, complications from that diabetes. In undergrad, I'm pledging the fraternity. I get a call. This when you still got calls in the dorm. I get a call that your dad just been diagnosed with colon cancer. My fraternity brothers, they weren't my brothers at the time, but they get together, get me money for a train ticket. I take the Amtrak home to Michigan to see what's going to happen to my dad's care. But all of that lived with me as someone who had the lived experience of people who experience these health disparities and health inequities. And that's why I dedicated my life to a career in cancer disparities research. And then couple that with finding out about Miles Square in 1966. My family is also rooted on the west side of Chicago. And the Griffin family at First Congregational Baptist, my family. And when I talk to my family members about Miles Square, all my family, they say to me, you know, I was born at Miles Square. Now, the interesting thing when they say they were born at Miles Square is that Miles Square has never been a hospital that has labor and delivery. But when they say they were born at Miles Square, that means that either their midwife or their community health worker or their nurse who worked at Miles Square was a key part of their labor and delivery, a key part of their child being born. My cousins. So when I got this job, they didn't care that I was a CEO. They wanted me to know I was born at Miles Square. I was there before you. I know the roots. I know the history. So that really ensured that I need to study this history. So when I found out about Dr. King's relocation, many of us know the story of Dr. King relocating to Chicago on Chicago's west side. But what we don't always know is that it was his speech that he gave in one of the public housing residents where he talked about health being one of the biggest disparities that exist in this country. And actually, it's one of the first times Dr. King was booed. We love Dr. King, but Chicago has always been about that life. And so when they booed Dr. King, they booed him not because they didn't want his presence, but they were like, this Chicago, this is the West Side. You got to come with some solutions. This speech is great, but we need some solutions. And he actually gave solutions after that. And the War on Poverty, President Lyndon B. Johnson, was launched. And as a result of that war on poverty, residents on Chicago's West Side got together and said, we need a community clinic to respond to some of the health disparities that we have for 1 square mile. Hence the name Miles Square arose from the fact that for 1 square mile, the community residents said, this is your catchment area. You will be responsible for addressing the health needs of the community members in this square mile. We weren't using the term catchment areas at that time, but that's what the community residents said, is that we are your service area. We're the community that you are going to be responsible to make sure that you address our health disparities. Our first founding site was on 2049 West Washington. And again, you look at that picture from the archives, and shout out to Aaron Atchison from our team for finding these photos. And then did you know that Miles Square was one of the first service areas, a neighborhood once facing some of the nation's worst maternal and child health outcomes? There's an article that I don't know how we can post it on our website if it's not already there. There was an article posted in 1969, around 1967, that talked about the health disparity of Chicago's West Side. If you remove that date, that is from 1967 or 1969, 1970, unfortunately, it looks like some of the same health disparities that exist today. And then a student once challenged me on that recently. They said, well, Dr. Watson, if those same health disparities existed in 1967, 1969, and today, and you say they look the same, what progress have you all made? I said, that is a great question. We have made progress, but what it shows us is that the work still needs to be done. Some of the same systemic inequities that existed in 1967 still exist today. We still experience the health inequities and the health disparities of redline. When we went to open up one of our school-based health clinics, and I'll get to that later, what we didn't know was that in that community area, we were opening up that school-based health clinic. Some community members were not willing to come to that clinic, even if they lived across the street. Guess why they were not willing to come to that community health center if they lived across the street? Because crossing that street meant crossing gang territory. And some of them were not welcome. They had family members that were not welcome. So actually, we had to learn from the community that even access is not always just about what you're next to. Access even goes beyond just where you're located, if you're located in the community, but sometimes it goes to where you're located in the community. So that then moves us to 2045 West Washington through a partnership with the city, and we get now one of the largest federally qualified health centers in 1985. What happened? Okay. So still continue with this concept of the past in 1990, but due to some some financial challenges of the landscape that was taking place. And again, it's important to remember, and this is not a political talk, this is a talk grounded in history and policy. Because the Affordable Care Act or things like that didn't exist yet, Medicaid reimbursements were difficult during this time. Medicare reimbursements were difficult. So community health centers, a lot of them faced a lot of financial and fiscal challenges. As a result, Miles Square had to close its doors in the 1990s. But through partnerships with the university in 1991, 1999, they actually began to open back up to say, how can we actually partner with community-based organization? Again, that concept of partnership has happened. Then and that's the new location that you see there. And that's a partnership with the city. And so Miles Square became an official component in 1909 of the University of Illinois, one of the only few public health sectors FQHCs in the US. I'm fortunate right now to participate in President Karriem's President Executive Leadership Program. And one of the things that I told the participant, talking to Mike, people online, all right, y'all, this is gonna make me stand still and talking to Mike, you know. I'll do it. Thank you, Dr. Hayes, for that encouragement. I'm always encouraged by people at UIC. So one of the things that happened was this partnership between UIC. Someone had a really good idea and said Miles Square should become a direct partner with the University of Illinois at Chicago. And what happened with that is that a community health center became a direct partnership with the university. And as I was saying to my helpers, my other participants in the President Executive Leadership Program, is that when you talk about community engagement, we're the only state institution where your community partner is embedded already in your system. You don't have to go outside the four walls of the university for community engagement. Community engagement here at UIC, UI Health, starts at home because you are the only academic medical center in the state that has an embedded community partner. That means when you think about building trust, building transparency, identifying the needs, we don't have to go outside the four walls. You can stop at any one of our 11 Miles Square clinics and ask us, what does the community need? How can we be a better partner to you right here? That's what that relationship in 1999 established. Only for us to enter into an amazing era of expansion under the former leader, Mr. Henry Taylor. I would be remiss not to, again, to say his name and the work that Mr. Taylor did to lead Miles Square in the expansion area, expanding fairly qualified health centers at a time when it was very difficult to expand them. But he did it because he had a vision and a commitment. The commitment of our board said that wherever there's health disparities in the city of Chicago on the south and west side, we need to be there. And that concept of we need to be there also meant that the space where you get your care should rise up to meet you. Just because you get your care in the community area doesn't mean that that space should be subpar. Hence that deserves an amen. I'm sorry, I should have gave this disclaimer. I am a church boy at heart. I'm the son of a Kojic. My mother was Kojic, my dad was apostolic, so you will hear a little Pentecostal stuff come out every now and then. But within that, when I think about the new home that we established on 1220 South Wood Street, think about the amazing piece of it. And if you come to our main location and you walk through it on that first floor, you will see curated art. You may think you're in an art gallery. You'll see a WIC center. You will see a pharmacy. You'll see a state-of-the-art imaging center. And why is that? Because the community should be welcomed with integrity, with excellence, and with service. So that's what the new era of ushering in Miles Square looked like. Now, where we are today to talk about Miles Square and the presence. As you heard in our introduction, we could provide primary care, behavioral health, oral health,
maternal health. We actually had to say women's health because of women's health across the life course, addiction treatment, and even cancer prevention. Our partnership with the UI Cancer Center really puts us in the forefront of being in a collaborative partnership. Under the leadership of former cancer director, Dr. Robert Wynn, I got a chance to do some work with Vince Freeman over at the UIC School of Public Health and Dr. Wynn to actually identify cancer disparities in every community area where we had a Mile Square Health Center. One of the things we determined, for example, in the Inglewood community on the Chicago South Side, that we talk a lot about the community violence that happens in some of our South Side community, but we're not talking enough about the health disparities that exist in those communities. Cancer and cancer health equity actually is one of the greater health challenges that faces some of our South Side community. I'm not saying that community violence is not important, but actually if we address the workforce development, if we address the access to care, access to education, a lot of the community violence that we see will actually be mitigated. That's not my opinion. That's actually evidence-based fact. There's data to actually show that when you provide a community with what they need or give them the resources to self-actualize and do what it is that they do and be the amazing community they are, they will flourish. That's science. So when I got this article from our board chair, Mr. Malone, he sent me an article that was recently published that says opioids have been killing the same generations of Black men in Chicago for decades. I got that article and I was not upset by getting that article because I knew that under the leadership of Dr. Nicole Gastala, who you'll hear from later, that in our present, we are addressing this issue head on. And in our present, when we think about the expanding to community clinics, I would invite you all to go to our Southside Clinic at Auburn Gresham, where there's a new primary and immediate care center in the Healthy Lifestyle Hub of Auburn Gresham. And I got a call from Carlos Nelson, who is the executive director of the Greater Auburn Gresham Development Corps. Carlos Nelson said, Karriem, Father Flager and I want to talk to Miles Square about opening up a community health center in the Auburn Gresham community. My first response was, well, Carlos, it goes a little different than that. That's not really how it works. He's like, you're going to make it happen. I was like, yeah, but there's fundraising that has to take place. He said, I heard you can write grants. I said, well, yeah, well, Carlos. And he said, so you good? Y'all gonna open up this clinic? Yes, Mr. Nelson, we're gonna open up that clinic. And the clinic was eventually opened up in 2022 and it's still flourishing to this day. Another thing about the present is addressing the workforce development that you'll hear more about. And our affordable certificates builds local workforce and expands the healthcare services to our dental assistants. Under the leadership of Dr. Sue Edmonen, our Senior Director of Dental and Oral Health, she saw a need. One of the things she said was that we're growing these dental clinics, but I need a workforce that reflects the population that we're serving. If we're going to have a clinic on the South Side, I need the community workers to come from the communities. And Dr. Sue, in her brilliance, decided to develop a dental assistance program. And now, and we think about the future of Miles Square, our COO said, don't leave my staff behind. Don't leave the medical assistants, the certified nurse assistants behind. And our amazing COO, Ms. Phyllis Grice, raise your hand, Phyllis, you're in the room. She don't like a lot of credit, but I have to give credit where credit is due. Phyllis said, I need to start a certified medical assistance program that mimics what we've done with the dental assistants so that we will have workforce development from the community. And we're partnering with Chicago Housing Authority to ensure that we identify people that are engaged with the Housing Authority to become part of the workforce in the communities where they live. And also thinking about strengthening our community roots and also community maternal and child health care model. If you've seen the data, the South and West Side of Chicago carry some of the highest maternal death rates, both for mothers and babies. And you all, this is despite education. Unfortunately, African-American women and now growing number of Latina and Indigenous women are the highest group that face maternal and child health disparities despite education. This is some work that was done by Dr. James Collin at Cook County over 25 years ago that showed that an African-American woman with a graduate degree, educated. So we think about education being that great course corrector. It doesn't always correct for health inequities and systemic injustices. And we see that with the birth outcomes in our African-American women and birthing persons. And so our ability to address this is going to be so paramount to us advancing the community and continue to do this work. So again, shaping what's next, workforce development, justice and reentry support, and also food as medicine. So as I end, when I think about workforce development and I was thinking about these images of trust, I couldn't think of a better person to call than Johnathan Banks Jr., because I've known Johnathan. I think I came to Apostolic Faith Church in 2001, and I think you were two? He was 2 at the time. And when I saw him grow up in the faith community, saw his commitment to community engagement, saw his parents' commitment to this service. And then he decided he wanted to go into healthcare. And that was kind of easy to do a little bit because he had been surrounded by an amazing pastor and Bishop Horace E. Smith, who's a physician and a graduate of UIC and alumni as well. And so having that leadership of people like Dr. Smith and seeing Johnathan grow up and then decide that he wanted to go in health disparities was a true amazing moment. But then the Banks, Mr. and Mrs. Banks didn't stop at Johnathan. They actually went along and had Justin. And so now we have going to have two doctors in the family, one a dentist and one a physician, but both committed to health equity. That's when I think about the future of workforce development. So when I was asked to talk about the image of the future, I'm going to say this, y'all, this was self-serving because I invited my future boss to talk about to talk about the future of this work. And then thinking about food as medicine. We did a small pilot project that was funded by Blue Cross Blue Shield where we said, what if we delivered food to our community residents who had uncontrolled hemoglobin A1Cs, which is an indication of your diabetes being under control. And when we said this, I thought it was going to be just a small program. Our dental director, again, if you'll hear me talk about her brilliance, she said, well, wait a second, Karriem. I looked at the data and patients who have uncontrolled hemoglobin A1C, uncontrolled diabetes, I'm also seeing a trend that many of them haven't come in for their dental visits in over 3 years. So there's some oral inflammation going on. You guys have to be really nervous when I say the word inflammation, because as a scientist, I can have a whole talk about the role of inflammation and what it does for health disparities, but that's another lecture. But in that concept, so imagine the concept that if you haven't had a dental cleaning in the last 3 years, who would think that that would be a risk factor for your diabetes being uncontrolled? But it was, right? Yeah, because you're a student here, so you know that. Yeah. That's right, because you're from the dental school, right. So having that concept and understanding, that really drove home the concept of food as medicine. And then at the time, I had another colleague, Dr. Kathy Tosis, who was studying the concept of gut microbiome and even the vaginal and cervical microbiome. What happens to women who have impacts of HPV and other things who have a stressful environment? And the inflammation that can cause in certain areas, and that inflammation creating an environment that can put you at risk for elevated cancer. All of this can be impacted by what we eat and the food we eat. But unfortunately, where you live can sometimes determine what you eat. Where you live can sometimes determine how long you live, and even if you live. So when I think about the future, I also think about justice and reentry support. I call it an aspirational justice system, but it's really a carceral system. So when we think about people who've been involved in our aspirational justice system or the carceral system, when they return back to our communities, think about all the challenges that they have to go through to be integrated back into the community. So when I was tasked by our board to think about a new population that we would serve at Miles Square, I couldn't think about a population better than the returning citizens who are coming back to their community. They should have access to healthcare and every service that they need. So our reentry program is also something of the future, because another thing that happens is that everywhere we have a Miles Square clinic, if you look at the data, those are also community areas that have a high recidivism rate. So we're doing something more needs to be done in that. And I'm excited about the partnership that UI Health has with the College of Law. I'm excited about working with Dean Nikki for what we can do with that. Imagine my dream and vision and hope and prayer is that everywhere we have a Miles Square clinics, that at least one of those nights we'll have a legal clinic in that area where all of our patients will be able to get access to a legal consultation if you become a Miles Square patient. We can do that, you all, because why? We're one band, one sound. We're all UIC, we're all UI Health. So we can do that legal clinic. If we can build the dental program and food as medicine, we can definitely build those legal clinics where we have Miles Square. But then also thinking about this concept of women's health. I was at an event last night. I spoke to someone who worked with our Carrie Stewart, one of our midwives, who started Melanated Midwives, talking about addressing the health disparities of birthing persons on the South and West Side. And she asked me, she said, Dr. Watson, what are you all doing about doulas? And how are you integrating doulas in your work? I said, give me your number, give me your email, because I can show you better than I can tell you about what we're doing to integrate doulas in our work. And then I said, but I'm having this challenge with doulas have to be certified in order for me to bill Medicaid for their services. Guess what she said? She said, my program is one of the programs that certifies doulas to be able to do the billing. So as I come to a close, when I took this job, Medicaid was safe. When I took this role, it was a different environment. And when things started to change, someone asked me and my family, they said, will you all be impacted by what's happening at the federal government? And I said, federal is in our name. We're a federally qualified health center. But I was reminded of something that a mentor of mine told me, that the assignment has not changed. When I went to them with this stressful stuff about what was going on in the government, what was going on with Medicaid, all the uncertainties, I had this vision for hires and buildings and all this. So I was nervous as a new leader. And I went to them, a mentor of mine, and I said, you know, I have this vision for what we want to do, but with these cuts to Medicaid and everything. And they just was sitting there listening to me and kind of looking at me. And he said, has the assignment changed? I said, well, no, Dr. Nguyen, the assignment hasn't changed. He said, okay, so has the need of the community changed? I said, no. He said, so it sounds like you have more in 2024, even or 20 with the cuts that may happen, than what they had in 1967. I'm just saying, it sounds like you may have more than what they had in 1967. So if the assignment hasn't changed, provisions for the assignment will always come. So that's the belief that I have, is that provisions for the assignment will come for us to continue to do this work. And we can continue to serve the community as we've always been doing. So as I think about, again, sharing this space, can y'all hear me okay? I now want to turn it over to our amazing, amazing panel that we have here with me today. And let me get myself together to introduce them. So we're going to start with images of the past. Not that Dr. Mary Marilyn is the past at all. She's very, very much active in the present. Dr. Mary Marilyn is a former resident of the West Side Lawndale community in the 60s and 70s. She's a graduate of Chicago Public School System. She began her nursing career as a graduate of Malcolm X Community College and has worked in several hospitals close to neighborhoods, including Mount Sinai, Cook County, Bethany, and UI Health Miles Square. She's employed as a nurse practitioner and remains committed to health equity and eliminating health disparities in vulnerable populations. Let's give Dr. Marilyn a hand before we bring her up. I'm going to introduce our other panelists real quick. And so talking about the present is our amazing Senior Director of Behavioral Health, Dr. Nicole Gastala, is a board certified in family medicine and addiction medicine. She graduated from Loyola Stitch School of Medicine and completed her family medicine residency at the University of Iowa. In her clinical role, she has developed and expanded the Medicaid Assistance Recovery Program by mentoring new prescribers, precepting residents, and training clinicians within the Chicago and Illinois area. She has also focused on the development of a walk-in integrated behavioral health, addiction, and primary care program within UI Health Miles Square. And then lastly, again, my future boss, we have the future Dr. Johnathan Banks, is a fifth-year dual degree student pursuing his DMD and PhD program at the UIC College of Dentistry. His NIH-funded PhD research concentrates on craniofacial mechanobiology and unstable mandibular fracture healing, and he has published several manuscripts and presented his findings locally and nationally. Johnathan serves as an anatomy peer tutor, co-president of his dental class, and he is passionate about helping other students reach their academic research and professional goals. Johnathan is a proud graduate of UIC, earning his Bachelor's of Biological Sciences in 2021. And I gave you all the caveat that I am from the Pentecostal church. You know, there is donations possible that you can do to keep this work going on. Whether you're supporting our urban health program, I'm actually very serious. Whether you're supporting our urban health program so that we can continue to support students like Johnathan. I'm being very serious right now. We actually need your support for programs, and Dr. Daryl Pennington is here for programs like the urban health program. We need support for those programs so we can continue to ensure that our students have what they need to continue to excel and exceed. So with that, I'll turn it over to Dr. Mary Marilyn.
Dr. Watson, thank you. Thank you so much for the opportunity to talk about what we need to have a healthy community right here on the West Side. Yes, I grew up here. I'm familiar with it. I know all about it, and I know the challenges of it. As we talk about what our past means, I'm going to take a moment to talk about things that happened in our past that continue to impact us today. Specifically in the 1960s, we all know the assassination of Dr. King. We know about Bobby Kennedy. We know about what happened with the riots in Chicago. What was significant about those riots is that it bordered the two main corridors of the West Side, Madison Street and Roosevelt Road. Some of that same geography looks no different than it did in 1968 when that occurred. Where you live, what it looks like, what you have access to impacts your quality of life and your health care. The challenge, Miles Square has a unique opportunity to impact health care for everybody in this community every single day. When you engage with the University of Illinois system, and it's a system, it's bigger than this institution, you should be greeted with dignity and respect. You should leave feeling like you were met with care, concern, and compassion every time without fail. That's the goal. That's the mission. That's what you have a right to expect. And we have the obligation to deliver that to you. So I'm going to digress a little bit from something that Dr. Watson said, because even though he said it, he didn't really mean it. He said this was not a political event. Do you know how much money is involved in healthcare? That means it's political. Do you know how much education costs? That requires money. That's political. Do you know what's happened to many hospitals and healthcare facilities on the west side of Chicago? It's related to money. That's political. So every time you think about what can you do, you must vote. You must be an advocate. You must express what you need every time to everybody who will listen. That's part of the past impacting our present and impacting our future. When we think about the contributions that we can make, it's systemic. It's not just about managing your diabetes or the incidence of colon cancer, maternal death. It's about what's your state of mind? How do you exist? How do you exist as a person? How do we value and recognize you? You will get nothing without demanding it. That's not a new concept. I don't mean that you have to pick it, but when you go for your provider visit, do you understand what they're saying? And if not, could you tell me what this means? That after visit summary that you're supposed to have, require it. It's easy to leave without it, but that tells you what happened during the visit. That tells you about your next appointments. That tells you what you should be doing. And as importantly, it gives you your vital signs. Those vital signs, those things that they take at every visit, tell you what is your state of health. Those vital signs can be a predictor of what's going on with your health and what's going to go on with your life. So pay attention to those numbers. Years ago, we participated in something called Numbers You Should Know. You should know what your height and weight is. It matters. You should know what body mass index is. It matters. Those things impact your life expectancy. Disparities are not something that happen in isolation over there. And we are in control of those things. Yes, we have treats. We can't have treats every single day. Or that body mass index and weight will do things that we don't want to happen. So in the past, the folks that Dr. Watson introduced to us, those women, they were committed to having the community be a healthier place. I'm going to ask that each of you be committed to not only health in the community, but your own health, the health of your families, the health of your friends. Collective action wins the race. So support Miles Square. Yes, funding opportunities, donations, of course, and I'll share with you something that I'm familiar with in terms of a program in the College of Nursing. In the College of Nursing, when I became a doctoral student there in 1987, I became the 7th African-American student to be in UIC's College of Nursing's doctoral program in a public institution in Chicago. So I was number 7 to graduate in 1990, and I know all of the ones before me. The first African-American student to get a PhD from College of Nursing was Dr. Marguerite Dixon. We lost her last year. But one of the things I think we have to do is give people their flowers and roses while they're here. So we started a scholarship in the College of Nursing in her name in recognition of her efforts, contributions, and support to all of us. There are some years that scholarship goes without a recipient. That's not okay. So where is the pipeline, the future of folks who will be educated to take up the work? So it's for the long haul. We come from a rich past of having survived much. I challenge you, don't let that past be in vain. Be an active participant. It is political. If you ask our congressman, and Danny K. Davis has been our congressman for nearly 40 years, It is political. Part of why Miles Square exists, because it's political. Part of why Stroger Hospital is there, it's political. So please, politics isn't a dirty word. Healthcare is a big business, and a big business that we can't afford to be without. So put your advocacy hats on, tell folks what you need, work for it, and our past can continue to guide our future. Thank you.
Awesome. Thank you. Well, thank you, everyone. So the next part that I want to talk about is a little bit about the present. So Dr. Watson really gave a great introduction about the opioid crisis that we have in the city of Chicago. As everyone may not know, that this is an old crisis. It's been here for 30 years, just like the article he shared, that it's killing the same people that it did 30 years ago. Now, I want you to sort of take a look at this. If you were to walk into the emergency room today and say that you had a heart attack and you were having a heart attack, what would happen? You would get a full workup. You'd get an EKG, right? They would give you a beta blocker. They'd give you medicine and aspirin. They would admit you and monitor you overnight, right? What happens if you walk into the ER after an opioid overdose? What happens? Maybe you get a handout on community resources. Maybe you get overdose prevention medication, naloxone, but do you get admitted? Do you get cared for? Do you get all of your follow-up care coordinated for you? And the answer is usually no. And so that has been one of the biggest gaps in care. And the reality is that that person who survived the opioid overdose has a much higher mortality in that next year than someone who survived the heart attack. And so that's one of the big health inequities that we see in our communities and why we've worked so hard to address it. And because of that, when we think about to the past as well, Dr. Watson talked a little bit about the justice system. The primary consequence of substance use is the justice system, right? Where we have treated substance use and opioid use disorder with going to the justice system rather than evidence-based care and treatment. This is a chronic health condition like any other health condition that we treat. So the equity of access to care, of evidence-based care has really been our focus the past few years. And the reality too is that much of substance use is stemmed in trauma and poverty. So if we don't have access to appropriate behavioral health care, if we're not ensuring that patients can help get supported through traumas that they may experience, that's when we increase the risk of substance use as well, then of course overdose and deaths. So through this, we've really focused the last several years on expanding access to medications, to expanding healthcare, but also to go out in the community and do trainings on overdose prevention. We have this amazing program funded through SAMHSA that allows us to do training in the community to help community members have access to immediate naloxone so that they can impact an opioid reversal. So we actually did some of our trainings, and some of our amazing community health worker, Tina and Angie, they, one time they were in, Tina was in a Walgreens, and she was just in line and a individual collapsed, and she had Narcan in her purse and was able to save that individual. So that is just sort of an example of how impactful engagement and community and having these resources in the community is so important. Another area that Dr. Watson also talked about is our maternal health initiative. Another area that has been really not gone as far as we've wanted to in the past several years has been those outcomes on maternal health, right? And those infants. We were lucky enough to be able to find funding through HRSA to support Dr. Carrie Stewart and the development of the Bellinated Midwives program at our Auburn Gresham location, really to expand access to equitable care. And this includes a whole model of care where patients get a doula, they get a midwife, they get dental, they get a nutritionist, they get a behavioral health referral. And what we really saw is that we've cared for over 493 patients, delivered 351 babies. 100% of those patients who wanted a doula had at least 2 visits with a doula and had them participate in the delivery. 69 patients who had gestational diabetes, 100% 50% of them had follow-up with the nutritionist and had an impact in their care. And we know, and 37% of those patients who had a depression, screening for depression, had follow-up with behavioral health. And that's a big difference compared to the national, which is about 22%. So really important that we continue to support access for patients through this community-based model. Another sort of dream that we have had and really supported is the access to behavioral health. Decreasing stigma, improving walk-in access, immediate access, impacting the social determinants of health around behavioral health and support. In 2019, when I first started this program with Dr. Watson, we had only about 782 visits per year and about 522 patients that received behavioral health services. And this past year, we had 23,000 visits for behavioral health and served over 5,000 patients. And we received the 2023 and 2024 designation with the FQHCs as got a gold standard for that. And so really that means that we've really focused on improving health outcomes through that collaborative model approach. Another present program that we are continuing to expand in the future is, again, the treatment for opioid use disorder. By working with community partners, we've been able to improve access to services. Methadone is one of those very controlled substances that has a great impact and is very efficacious in terms of improving outcomes. The number needed to treat for a patient, which means that when we look at number needed to treat for different parts of medicine, the amount of patients you need to treat in 1 year to prevent one death, right? So the number needed to treat after an opioid overdose for methadone is 39, and for 37 is buprenorphine. If you compare that to screening for breast cancer, you have to screen over 3,000 women to have that one impact. So when you think about a medication or an impacting modality, it's just such a life-saving access point. So we wanted our patients to be able to walk into Miles Square, get their primary care, dental, anything else that they needed, and then be able to get their treatment for opioid use disorder. So we were able to do that through community partnership and ensure appropriate follow-up. And then lastly, really just wanted to share this patient story. So is this a video? So this is an example of one of our amazing patients, Kayla Perkins. So through this maternal health program, we've been able to provide baby showers as well as maternal support groups. And so this is one of those that we had where we had a baby shower where our patients could get the different supplies that they needed and get that collaborative support. And so we really wanted to create a community environment of maternal health care for our patients, and really thank you to Dr. Carrie Stewart's leadership for that, because it really has had such an amazing outcome and impact. All right, Dr. Banks, your turn.
Hello, everyone. It's an honor and a privilege to be here. As you all have heard, my name is Johnathan. I am a dental student at the UIC College of Dentistry. I'm right over there. Come by, visit us anytime. Thanks to Dr. Pendleton for being here. And once again, acknowledging, well, I'll get to that in just a second. This is a few images of me. There was some text there on the right, or the text is white and so is the background, so we missed it. But Dr. Watson said earlier that this is about images of trust. So the words are less important, right? I heard somebody say seeing is believing once. So these images are just highlights from my short time in dental school. To just tell you a little bit about me, I grew up about 25 minutes from UIC College of Dentistry. In my first experience with UI Health and with Miles Square specifically was with Dr. Sue Edmondon. She's not here, so you got to think, if we're talking about someone this much and they're not in the room, they've got to be someone of significance and importance. But Dr. Sue Edmondon was awesome because she took me in as a dental student, allowed me to volunteer, shadow, and assist, and early on, it set me on the path towards a quality dental education at UIC. She was a pivotal mentor, and I came into dental school with the perspective of someone who was public health trained, and someone who had an FQHC background. A lot of times dental students, they arrive to the dental clinic or to dental school and they're excited to make money or have a private practice clinic in their own town, just like the dentist that mentored them. But I came in with the perspective and an understanding that there is a dental need, not somewhere far away. Like we said, health disparities are not far. They're in our communities. They're in our Chicagoland neighborhoods. And having seen patients up close, I was able to learn at the feet of Dr. Odehmenan and come into UIC Dental ready to make an impact in our Chicago community, which UIC is all about. But even before I started dental school, like I said, Dr. Odehmenan taught me how to serve in dentistry. And if I can't serve in dentistry, I got to serve somewhere. So we all know in early 2020 that the COVID pandemic began to affect people in the United States. And at that time, I was no longer welcome at the Miles Square South Shore Clinic. Now, there are very few things that will make you not welcome at a Miles Square Clinic, but if you're a student volunteer and there's COVID, you are not welcome. But instead of allowing me to relax and enjoy online classes at UIC, because I was an undergrad at the time, Dr. Odehmenan emailed me and she said, "Hey, what are you doing on Saturdays? We started this Food is Wellness program with Blue Cross Blue Shield. Do you want to be a delivery driver for these patients?" And you know, me, I'm in college. I have my driver's license. I'm like, yeah, let's go. Let's do this, right? Because I like to drive. So this is my brother and me. My brother, Justin, who Dr. Watson mentioned, he is a second-year med student at University of Chicago, doing awesome things, works with Dr. Wynn closely. And back then, he was just being an awesome younger brother. As you can see, this is a 3-row SUV filled. We put the seats down and stuffed food in the back so that we could travel all across Chicago South and West Sides and serve the Miles Square patients who had food insecurity, who needed food support. And I could spend more time than we have talking about the patient feedback that we were able to get. But this program was another learning experience for me where I learned that serving patients goes beyond clinical excellence. It involves seeing the need in the community and doing whatever we have to do to meet that need, and not just putting the problem in the hands of, you know, the experts will handle this. No, I learned to be a part of the solution to problems that I see affecting the communities in Chicago and affecting patient lives. And I've been blessed as a dental student to be able to be involved in research. As was mentioned earlier, I am a DMD PhD student. So I spent the first 3 years of my graduate training doing research on craniofacial biology and studying how bones heal after trauma. But research has been an avenue for me to help reach other dental students across the country. And in this image, you can see me attending the Student National Dental Association, or an SNDA meeting last July, talking with dental students about how research can help them elevate their quality of dental education. As was shared in my bio, I am very passionate about helping students reach their clinical goals and research and academic goals. So in a university environment like UI Health, we are very research-based. We are very evidence-based. And I was able to, through this opportunity, talk about the benefits of incorporating research into your clinical training, because the more clinicians who have a research background, the better we are to have evidence-based training and evidence-based clinical care that improves patient lives based on data and what we're seeing in clinical trials and basic research. You can see here, these are some of my favorite images. I was able to, through the urban health program and other opportunities, go to different high school programs, middle and elementary school programs, and really engage with the community through teaching them hand skills, and you can see in the bottom right image, to hopefully inspire that maybe not dental spark, but healthcare spark. Show someone that there is a career that you can follow in health that'll allow you to improve your community and have the type of life that you still want to live while making a difference. And you can see in this top image, you might be wondering, what is going on? Well, this student was showing me that he knew how to floss by using an extension cord in the room and treating me like a tooth and going in there and just showing the flossing technique. And we didn't need fancy, you know, the school supports us when we go to different programs, but we'll also work with whatever they have, because a large part about education is working with your target audience to make sure they get it and make sure they're engaged. And that's what we learn here, how to be engaged with the community. We send students who are familiar with the communities that we serve. You'll notice we have some students from underrepresented minorities in health going to these schools, such that it's faces that are recognizable. I want students to be able to see a future that they can participate in. And I've been blessed to be able to participate in these programs, sharing what dentistry is about, sharing what healthcare, what a career in health is about, and with basic community engagement and education, such that patients are learning what to eat, what not to eat, how to brush, and to build trust. That's what this event is about, right? And trust involves seeing your future dentist and helping them put a smile on your face when you're showing them how to floss. And then last but not least, I talk about research at different areas. This is just I included this slide because excellence is very important. Sometimes people think that community care means we can submit whatever our effort is. It doesn't need to be our best effort. They'll take anything, right? If we're not being paid like the private practice, maybe we can lower the quality of care. But I already see people shaking their heads because you all understand that every patient deserves the best. I've been privileged at UIC to get the highest quality training, and that's been reflected in award-winning research competitive presentations at the national level. UIC is not a mid-rate school by any stretch of the imagination. We're sending students who are well-trained in research, well-trained clinically, and it shows through my awesome research participation. Let's see. Yeah, that's the last slide I have. So essentially, I'm grateful to be able to talk about how UIC has trained me and so many more students like me, how they trained Black and Latinx students from different backgrounds to serve and make an impact in their Chicago communities. And we're building trust that way. So I appreciate y'all, and I look forward to your panel question.
So one of the things I was taught by my mentors, and I conclude Dr. Barish in that and Dr. Nguyen, is to get really, really good at recruitment and talent identification. So one of the best things I've done in this new job is identify talent like Johnathan Banks and the future. Don't you all feel a little bit better about the future that we have ahead? Seriously, like when you, because these are the stories that don't make the news, right? These are the stories that we're not hearing, but these are the stories that can give us hope and let us understand that we have a future that is actually in really, really good hands. Now, I want to open up to the audience for questions and see how you all think about this. But before I start, I actually want to put someone on the spot. I want to actually ask, Mrs. Banks is in the room, Johnathan's mother. You mind raising your hand? And so that's right. You've done amazing, amazing. Yes, thank you for having us. Any questions from the audience that you all have right now that we can engage in a conversation about how can we do better at responding to our communities and continuing to adhere to the pillars of the center, even around cultural humility, trust, service, and excellence? How, what are your thoughts and concerns and questions?
Extra food to whoever goes first. Please grab food. If you all haven't engaged with food yet, please do grab some food. Questions. We have some pre-prepared questions, but we want to make sure we give it to you, and we'll keep an eye on the chat as well.
Hi, I'm Margaret Moser from Health Affairs. This is one of the best talks I've heard in a really long time, so thank all of you for being here. And I guess my question, Karriem, we were talking before this thing, is just the question, what do we do? And I appreciated, Mary, the questions about advocacy and what can we do? And I'm just wondering, one, what can we do here, those of us in the room? And then two, what metrics do you use around trust? Like, so this is, I'm in school, and some of our coursework is around critical community engagement. And so trust is always one of those cornerstone ideas. But as a person, as a practitioner, how do you know when you've successfully got to trust, I guess? How do you know when you're there?
I'll start and then pass the mic along. I'll put on my researcher hat now. Some of the work that I've done in cancer disparities research has been around this concept of citizen scientists, where you engage people from the community as actually advocates in the science work. And so within our work, and Andre Moore, our new director of compliance, is actually one of the research assistants, raise your hand, Andre, that I'm a former teacher too, so I was like, raise your hand, Andre. That was a part, we actually had a question around trust. We did it both quantitatively, where we wanted to get a scale, and then we also had a qualitative question around trust. And I'll never forget one of the answers, Andre, and I don't know if you remember, one of the citizen scientists gave us about trust. He said, Karriem, I may not, because I was like, do you trust the healthcare system? Because we had these series of 6 questions that were validated about trust. It was like, do you trust the healthcare system? Do you trust your provider? And one of the participants said, the answer to all these questions is no. I don't trust the healthcare system. I may not necessarily trust my provider. I don't necessarily trust this institution, but I trust you because I have a relationship with you. So what I learned from that data, from that research study, is that relationship is sometimes a proxy for trust. And the way we can measure trust is also sometimes by the human experience. Do people return back? So when I look at our no-show rate, I'm not just looking at the fact that people canceled their clinic visit, but what was the reason why this person did not come back? Was it an access issue? Was it an experience they had where they didn't have a good experience with us? Those are all ways that as a scientist and as an administrator, I think we can measure trust. But a lot of it is that qualitative feedback. I'm lucky to have our community specialists here because they hold me accountable. I'm serious. One day they came up to me and they said, Karriem, you have to continue to walk around the clinic because there's some things that's not going to show up in the Press Ganey surveys. There's some things that you're not going to see unless you actually go sit in the waiting room and observe what is happening. So some of this trust has to be about what we see in terms of relationship building, but I'll ask the rest of our panelists to comment on that.
Absolutely. And wonderful question in terms of we're an academic institution. We are accustomed to data. We should be very committed to metrics. So one of the things as you leave here today, you should have in your mind, in 6 months, what can we see that changed because we had this conversation? And we have to always be held to a standard that forces us to demonstrate what have we done. When people don't come to clinic, what happened? Do they have an experience that we aren't acting on? Do they understand the relationship between that last after visit summary and that blood pressure that wasn't in range and what they ate and what they need to do differently, and that we're going to follow up and we're going to ask, did you get your medication? So the relationship can impact what the metrics are, but hold our feet to the fire. We owe you that, and you have to be an active participant to be sure that in 6 months, a year, we have improved metrics and outcomes because of the work that we're doing together.
So I think as a clinician, my experience is a little bit different. So when I think about my relationship with my patients, I think that's where the trust always comes from, because most of my patients, we don't look like each other, right? But they really share their experiences with me, and trying to create that environment that is safe, that is probably different from what they've experienced in the past. We're creating an environment where they can be honest, particularly in substance use, about continued use, and being able to share, knowing that I'm there. And I always do this with patients or talk to them about patients. I'm like, how can I help you live your best life? Like, what can I do to help support you and your health, right? And in your life. And that's how we start. And that, I think that makes the biggest difference, because there is no judgment. I'm just here to help support them and create a environment where they can heal and get the care that they want and need. And so I know, Johnathan, you talked a little bit about, like, in your talk about how making sure that FQHCs don't give less. And I almost think we need to give our patients more. We should provide concierge medicine to our patients because they are the ones who deserve it the most, right?
Thank you. Yeah, everything, I totally agree and support what everyone has shared. And just my small piece to add, you asked about what can we do. In preparing for this talk, I reflected on how I got here. Now, I am not there, I am here, but to get here took a lot. Dr. Pendleton knows the urban health program, the early outreach program, pathway programs are why I'm in dental school right now, why I've been able to get accepted, get funding, be involved in research. My first research experiences were through UIC affiliated health science programs and cancer disparity programs like the Chicago Check Initiative. As I reflect on how I got here, that helps me target the ways I can apply myself towards the future. So I'm looking at pathway programs. How can I support those programs so students coming behind me have not just the same experience I had, but a better one? How can I give what I have? I may not be loaded, but I can give my time. I can volunteer at as many early outreach programs, as many early access pathway programs as possible. I can say yes to as many speaking engagements as possible so that as many students who need to see a Black dude in dental school can see that someone can apply themselves academically and in the healthcare field. And I wrote in my notes, and I completely forgot to say it, but if a door was open for you, leave that door a little opener, leave it a little wider for the person coming behind you, such that, and whether that be through donating or through serving, such that the people behind us should have more access. We talked about the disparities that are still existing. We should obviously want to minimize disparities, but improve access as much as possible to students who are coming behind me. That's what I like to focus on.
Thank you. Thank you all so much. We have one from online. I want to engage our online audience. Thank you for being here. One of the questions from the folks online is they really clung to your trustworthiness, Dr. Watson. So they're wondering if you all think that trustworthiness is better now than it was decades ago, and what caused that shift if it's better than it was.
Whoa, thank you, online person. Trustworthiness, I will say that it's always a journey. And like I started with, the reason I like the concept of trustworthiness versus trust, because in saying trustworthiness, you acknowledge the inequities in the system. To say, trust me, and I don't even like to tell people, oh, come to me and be vulnerable. No, being vulnerable sometimes could put you at risk. Saying, vulnerability is for safe spaces. Every space is not safe for everyone. So sometimes the leadership, we need to be vulnerable and transparent and create these trustworthy spaces. And I think it's important really now that we have these spaces of trust. I remember a conversation from Dr. Gastala when she shared with me that, so again, to go back to the first question, how do we measure trust? One of the proxies of trust was when she told me I had a patient in clinic who needed treatment, but they had a partner in the waiting area. And that part, because of the treatment they got, they were able to say, I'm gonna bring my partner in to get additional treatment as well. That's the trustworthiness that we're talking about. We constantly meet community members that need the care. And one of the things our community health workers and community specialists talked to me about was, Karriem, we're out here in the community. They trust us. They see us at the grocery store. They see us in their faith-based communities. They see us. So when we send them from the community to the clinic, they have to have a similar experience in that community clinic that they had in the community because of that trustworthiness. So it's not an easy answer. Do I see a difference? I see a call for us to even be more trustworthy now in the current environment that we're in. I don't know if my other panelists want to have anything to say.
So trustworthiness is a continuum. It's not a static thing. So as a nurse in Cook County Hospital way back when, in the emergency room, folks would come in, and I was very clear that the person that I was looking at was related to some type of substance, but the person was only telling me about chest pain. So as I listened to the story about chest pain, I thought, this isn't working, because I have to do a certain amount of things once you tell me you have chest pain. So overdeveloped trustworthiness and relationships with those patients, I could begin to ask the question, did you take something, and if you give me the correct answer, I can get you treated the best, quickest. Then sheepishly, I might have had a little something. So then we can change what we're doing. We're not going to waste resources on pursuing something that wasn't the problem. With my current patients, and I see patients in their homes. So developing trust is, I'm not judging your surroundings. I'm here about your health care. I'm not blind. You're diabetic. Your A1Cs aren't in the right place, and there's sweet cereal on top of the fridge. So maybe that's not the first thing I point out, but before I leave, we have to talk about the relationship between diet and your A1C. So now, and I'm new to doing home visits, less than 2 years. My patients, in terms of establishing trustworthiness, will come out and greet me while I park. So they are looking out for me. They know more about their environment and the perceived trustworthiness that's required of me being in their space. They'll go to the door and watch me go back to my car. So trustworthiness is how you interact with folks and how you build relationships. And it's the provider, it's the institution, it's our responsibility to take that on to impact outcomes.
I would also say that when people bring their families and their loved ones to you because they felt safe, that is one of the most, I think, powerful things, to be able to take care of a whole family. A parent who has a substance use disorder who's willing to bring their kids in for care, knowing that you're helping them and you're helping their family, is really just a very important, vulnerable state. To be able to create that environment to support them is just really, really important. And I think one of the most important things that we do.
Yeah, and in dental school, and I assume at University of Illinois, it's ubiquitously taught. We are taught how to build trust with our patients. Like we said, trust is earned, and it is not simply you offer them this pamphlet or you provide this script and you will be trusted. But there are things we can do to show ourselves as approachable and honest, and those things include acting ethically and treating patients with the empathy and the thoughtfulness that we'd want ourselves to be treated with, if not more so. So we get taught in school not only about ways to build patient relationships, which can be a proxy for trust, but also we get taught about ways that medical mistrust has even been caused in this country in the past. We learn about Tuskegee, and we learn about Henrietta Lacks, and we learn that we are not at zero when it comes to trust. A lot of times we are behind zero, and we need to work towards building trust, starting with acknowledging the fact that trust has been broken. And without that perspective, I would be nervous going to a school where we're not taught that. But I'm proud to say that we learn these critical aspects of the healthcare system more broadly, and it allows us to hopefully reach a place of trustworthiness in our patients.
I want to highlight too the other question of what can we do. But Johnathan mentioned the program, Chicago Cancer Health Equity Collaborative, Chicago Check. Both Johnathan was a research assistant in that program, got a research exposure to that program, then is able to work in the program as a mentor. Andre Moore was a research assistant in that Chicago Check program. That program was funded by the National Institutes of Health, the NCI. That program does not exist anymore because funding was cut for that type of programming for the Center for Cancer to reduce cancer health disparities. So when you hear about these NIH cuts, and you want to say what's the face to happen to those cuts? Those cuts affect students like Johnathan, and now employees and lawyers now like Andre. Without those types of programs, they wouldn't have got the exposure that they now have to have the experience to be here. So I just want to put a name to a face. So as you're hearing those news articles about what's happening at the NIH, you may say, well, research doesn't really impact me. You know, that's what's happening at the NIH. It 100% impacts you, me, and the people that we serve. So.
All right. Hello, everybody. My name is Marissa Charleston. I'm the new director of the Early Outreach Program, Urban Health Early Outreach Program, and Pre-College Programs at UIC. It's a very long title. And like Johnathan was talking about, Johnathan did come through our program. I taught Johnathan. And so I was just wondering how you guys were talking about the the melanated midwives. And then we did a section of the early outreach program where we focused on maternal health rates, Black maternal health rates. And we were wondering, well, I'm wondering if and how we can partner with you guys. We have our middle school program as well as our high school program. And we would love to see, you know, students hearing from people like you in the community, and so that we can create more Jonathans. So if it's just a shameless plug.
And we happen to have our COO in the room who will work with me to make sure that happens. So that's done. It's done.
So part of the things that we can do are interact with the community purposefully. A program that was developed, a program that was developed in the College of Nursing years ago when I was a recruiter there, it was called I'm Ready. The acronym was Increasing Minority Representation Through Educating and Developing Youth. We need young folks to be ready. They need to participate in this institution. It's in the community. We owe them mentorship. We owe them scholarships. We owe them interest. We owe them our time. They are our future. Some of this has been successful in the past. Ethel Caldwell was one of your predecessors in the early outreach program. I know a little bit about the past. Those efforts are key to continuing to have success. So hold our feet to the fire. We can do this.
I also have to, I know we're ready to close, but I want to acknowledge one of our board members, Mr. Randy Gibson, in the room. And I was going to ask you just take 2 minutes to talk about the history of your mother and her vision for Miles Square back in the 60s and when we first opened and what it means for us to continue to be responsive to the vision that she had.
So my mother was a busybody. She was a big community activist, right? I remember in grammar school, they would come in and give us shots, right? I also remember my mother and some other ladies, and we lived in public housing. They would walk us over to Cook County Presbyterian. At one point, they might come over every other week for whatever it was, but it'd be 15, 20 kids, 3 or 4 mothers. I remember this doctor supervisor telling me, well, maybe we could send somebody over there where you all live at as opposed to you all coming over here. Subsequently, the first building they had, I think it was on Warren or Washington for Miles Square. But my mother was a big advocate for anything that had to do with women or children. She was the PTA chairman and any and everything else that had to do with women and children she was involved with. Anything that had to do with education in the neighborhood she was involved with. Say like little things like towards the end of the month, and if you had ladies who were on welfare, and my mother would say things to them like, well, you know, you don't have enough money to do this. Why don't we all get together and do this? Same way she had a community service center. And she had a GED program. And this is one of my favorite things to talk about. She had a GED program. And she would say to the ladies that lived in the public housing, did you finish high school? And they might say, no. Well, you know, you can get a job with the city or the state if you have a high school diploma. Well, I only went to a year. Well, my mother would have a GED program. If the woman didn't show up, they would go knock at the door. They was in the same building and say, why didn't you come? I didn't have a babysitter. Well, bring your child downstairs. We're gonna have somebody read them a story. It's always been about how you can do it. It's the approach that you can do it. And that's one of the things I've always liked about Miles Square. Subsequently, I was calling people, asking them, did they have any old photos, right? I probably called 35, 40 people who were from that area in the last few days. And a lot of these people were so happy about what Miles Square was to them. One person I spoke to used to be my best friend's sister. She was kind of nerve-wracking, but now she's a professor of nursing in Georgia. But the thing about Miles Square is always, how can I say this? It's always been there for the community. It's always allowed you to come back to it. And that's an important fact. I can think about some other health places I've been to. I could see was what your insurance is and what your money is. I've been to Miles Square when I was unemployed or when I had some of the best insurance going. But it's always been that they didn't ask for my insurance. They asked, what's the help you need? And that's important when you do anything in the community. And, you know, and I like some of the future things that are going on, particularly for us advocacy for some of these people that have drug problems or coming out of prison. We have to address that. A lot of those things are mental health. And I think I heard at one board meeting, somebody said, well, we're gonna go back and speak with them about what was your dream when you was 13 or 14 years old and change their thinking. But it's important that you get out and speak with people. You know, it's important. Women health and children's health are important. That's what builds our community. And I do say a few things to men about their colon, their prostates. I tell anyone, come over to Miles Square, just bring your ID, they'll get you help. But that's all I have to say.
Thank you. Thank you all so much. Thank you to everyone online as well. Miigwech, that is one way to express thank you in Potawatomi. It expresses a desire to reciprocate again in the future. Miigwech, Dr. Watson, Dr. Maryland, Dr. Gastala, and the very soon to be double doctor, Johnathan Banks. Miigwech to the Odeh Center team of Cassandra, Samina, and Makeda, and our Office of Vice Chancellor for Health Affairs partners, Michael and Brian, and miigwech to all of you, both in person and online. We hope you're able to join us on our journey of spotlighting all 5 of our core commitments. Next month, we will spotlight health equity, and we will be hearing from Dr. Monica Vela from the College of Medicine, who will be discussing the importance of language concordant care on health equity. This will be on Wednesday, September 24th at noon. We will also again provide food. We will have extra sweet treats for you that day. This is me teasing you a little bit more about the food. So please mark your calendars. And you'll see on the screen and in the chat online, please scan the QR codes on the screen to sign up for our newsletter if you're not already signed up, so you can find out more details for all of this. And also please feel free to provide feedback on today's event. And thank you so much. Bama Pimain, or until another time, in Potawatomi, as there is no word for farewell, as we expect to see each other again very soon. Thank you so much.